Good afternoon, and welcome to our congressional briefing and national webinar on the report, The State of Obesity 2022, Better Policies for a Healthier America, hosted by Trust for America's Health, or TIFA for short. My name is Tim Hughes, the External Relations and Outreach Manager at TIFA. We would like to thank our speakers and audience for being with us today. Real-time captioning is provided today by Cynthia Thompson from AI Media. For captions, click on More at the bottom right of your screen with the three dots. Next, click on Close Caption. Next slide, please. And one more. We encourage you all to share your thoughts and questions about today's presentation by typing them into the Q&A box. We'll try to answer as many as we can as time permits. To open the Q&A box, click the Q&A icon at the bottom of your screen. From there, select Enter when you are ready to submit your question. Next slide. And now it is my pleasure to introduce the moderator of this event, Dr. J. Nadine Gracia. Dr. Gracia is the President and CEO of Trust for America's Health. She is a national health equity leader with extensive leadership experience in federal government, the nonprofit sector, academia, and professional associations. As President and CEO, she leads TIFA's work to advance sound public health policy, address the social determinants of health, advance health equity, and make health promotion and disease prevention a national priority. Welcome, Dr. Gracia.
Thank you, Tim, and welcome to everyone who is tuning in from our audience for today's important discussion. As Tim stated, my name is Nadine Gracia, President and CEO of Trust for America's Health. I'd like to thank you all for joining us today for this congressional briefing and national webinar that is focused on the 2022 State of Obesity Report. And I'd like to thank our esteemed panelists for taking the time to participate in this briefing. And we're so honored to have all of you here. Next slide, please. Our agenda for today's briefing is on this slide. After you hear presentations from each of our panelists, we're going to have time for questions and answers from the audience. And before we get to our panel, I'll start with a brief overview of the findings and recommendations of TIFA's 19th annual edition of the State of Obesity Report that was released in September. A copy of the full report, including state-specific information, is available at tifa.org on our website, and we'll include a link to the report in the chat. Our goal for the briefing today is that you leave knowing the latest data and trends in obesity in the US and learn some concrete examples of how we can work together to really advance policies and programs that address the social and economic conditions that contribute to this increasing epidemic. So let me begin with some framing as we talk about this issue of obesity. You know, it's important to note that we're addressing obesity because it is a common and a serious chronic disease among both adults and children. It has both health and economic costs, where it puts a strain on individuals and families, affecting overall health, healthcare costs, productivity, and even our military readiness. But this isn't a focus on size. It's about how to create the conditions that promote healthy weight to prevent the serious consequences of obesity, which increases the risk of many conditions such as type 2 diabetes, high blood pressure, stroke, and depression. Now, as we describe in the 2022 State of Obesity Report, rates of adult obesity continue to increase and have been rising, unfortunately, for decades. Nationally, 41.9% of adults have obesity. That's more than 4 in 10 adults. West Virginia recorded the highest rate of adult obesity at 40.6%, and the District of Columbia had the lowest rate at 24.7%. In 2021, the data that were released this year showed that 19 states had adult obesity rates at or above 35%, and that's shown on the map of the states that are in red. And that's up from 16 states the year prior. Then to put that into further context, a decade ago, no state in the country had an adult obesity rate at or above 35%. We know that in addition to obesity rates increasing nationally, there are significant racial and ethnic disparities in rates of obesity. Obesity rates also vary by education, income level, and geography. where adults with lower income, with lower educational attainment, and those who live in rural areas and counties are more likely to have obesity. But it's really important to underscore, as you see on this slide, that obesity is caused by a combination of factors, including societal, biological, genetic, and environmental factors, many of which are often beyond personal choice. The data show that racial and ethnic disparities in obesity rates are stark. Yet it's important to understand that much of these disparities are due to longstanding structural and systemic inequities that exist in many communities of color, such as multi-generational poverty, lack of access to affordable, healthy, and nutritious food, and lack of safe and convenient places to engage in physical activity. And you're going to hear many of our panelists focus on these very issues, these structural drivers, during our discussion today. In addition to the data in this year's report, there is a special feature that's examining food and nutrition insecurity among children and families. Food insecurity is driven by many of the same social and economic drivers and factors that drive obesity. And in particular, you'll hear from Dr. Bleich at the US Department of Agriculture, who will talk about nutrition security and its importance with regards to health and well-being. Next slide, please. So while access to the quality of healthcare is a component of addressing obesity, there are factors outside of the healthcare system that are really playing a significant role in the increasing rates of child and adult obesity. The conditions in which people are born, where they grow, where they live, work, play, and age all influence health outcomes. And so it's critically important to advance evidence-based policies and programs that will help to address these issues and to invest in communities to ensure that everyone, regardless of income, age, race, and ethnicity, or where you live, has the opportunity to be as healthy as possible. So in our State of Obesity report, we include several evidence-based policy recommendations that address these structural and systemic issues. And I'll highlight a few of our recommendations, and I encourage you to look at our report for the full set of recommendations. In our first area of recommendations, support expanding funding for effective programs at the Centers for Disease Control and Prevention, starting with overall funding for CDC's Division of Nutrition, Physical Activity, and Obesity. You know, where you have underfunding, it means that not all states can benefit from proven programs, such as the State Physical Activity and Nutrition Program and the Racial and Ethnic Approaches to Community Health Program, which allow communities to really be able to address those broader community factors that contribute to increasing obesity rates. We also support the President's budget request of $153 million for CDC's Social Determinants of Health Program, which would support multi-sector efforts to address the community conditions that influence health outcomes, including many that we're describing today. In our second area of recommendations, we address decreasing food insecurity while improving nutritional quality. And that's critical and important that we work with Congress to strengthen essential supports for individuals with low incomes through programs such as the Supplemental Nutrition Assistance Program and WIC. Furthermore, school meals are one of the most consistent sources of healthy food for millions of children who are at risk for food insecurity. So we should not only extend healthy school meals to all kids, but also ensure that the meals are keeping up with the science on dietary guidelines. Our third area of recommendations centers on implementing new taxes of sugar-sweetened beverages like sodas. These policies have shown to decrease sugary drink consumption and decrease rates of obesity. And when funding is actually directed into improving social and economic conditions, the communities that are most impacted support these policies. The fourth area of recommendations that we discuss is ensuring that opportunities for physical activity in the built environment are safer and more accessible for all. Organizations and governmental agencies should be working together to help communities that really are under-resourced and rural communities, for example, apply for and access the Bipartisan Infrastructure Act dollars to help increase active transportation opportunities. And lastly, we discussed the role of the healthcare system in preventing and treating obesity. Millions of individuals in the US still lack coverage, and there are significant disparities in access to care by sex, age, race, ethnicity, education, and family income. Access to care and coverage, as well as the quality of care, are foundational to obesity prevention and treatment, as well as to overall health. And that's why eliminating those barriers to healthcare coverage is so critically important. All of the issues that we're going to be discussing today certainly are going to need to be examined and addressed in a multifaceted way. And you're seeing this as exemplified by the panel that we're going to have today. TIFA released our State of Obesity report the day prior to the historic convening of the White House Conference on Hunger, Nutrition, and Health. And I'm sure many of you may have tuned in or attended the conference, and you'll hear more about it and the national strategy from our panelists, in particular from Kat Okar from the White House. The White House Conference was a pivotal event because it brought together stakeholders and partners that are working to advance food and nutrition security, to increase physical activity and improve health outcomes. And TIFA was pleased to see that many of our recommendations from our State of Obesity report really align with the policies that are outlined in the National Strategy on Hunger, Nutrition, and Health, which we feature on this slide, listed by the pillars of the national strategy. Now, as TIFA looks to the future, we are hopeful that Congress, that the Biden-Harris administration, and that state and local governments will continue to make progress to end food and nutrition insecurity and create healthier communities. So in particular, using some of the momentum generated by the White House Conference on Hunger, Nutrition, and Health, we are continuing to help lead a multi-sector coalition of nutrition, active transportation, and physical activity stakeholders that is advocating for expanding the state physical activity and nutrition program, the SPAN program, to all 50 states and the US territories. Currently, the level of funding for that program is only sufficient to fund 16 states in the country, and yet this is a national issue. We also support Congress passing the Child Nutrition Reauthorization in a bipartisan fashion to strengthen and enhance child nutrition programs. We also urge the Food and Drug Administration to research and issue a proposed rule that would implement a mandatory front-of-package label on food products so that we can advance equity and increase nutrition education. And we also are supportive of the recently released proposed rule updating the WIC benefit package to permanently increase the fruit and vegetable benefit increase. Next slide, please. So I know that's a lot of data and a lot of information, and each of our panelists are going to go into more of these areas in particular in their presentations, and we'll have additional time to talk about this during our question and answer and discussion period. So with that background and overview, we're going to transition now to our panel presentations and discussions. We're going to save questions for the end, but just a reminder to submit your questions in the Q&A box, not the chat, and we will get to those questions after the presentations. I am now pleased to welcome our panel. Dr. Sarah Bleich, who is the Director of Nutrition Security and Health Equity in the Food and Nutrition Service at the U.S. Department of Agriculture, after serving as the Senior Advisor for COVID-19 in the Office of the Secretary at USDA. Dr. Bleich is a policy expert and researcher who specializes in diet-related diseases, food insecurity, and racial inequality, with more than 175 peer-reviewed publications that are really advancing the field. Next, we'll hear from Cheryl Lee Sherry, who brings 40 years of leadership and program development experience in community health and healthcare to the Minnesota Department of Health. Cheryl Lee is currently the manager of the Healthy Systems and Communities Units for the Office of Statewide Health Improvement Initiatives and is the lead for Minnesota's CDC State Physical Activity and Nutrition Grant. So that program we've been talking about, the SPAN grant, it leads Minnesota's program, and we'll hear more about that. Thirdly, we will hear from Kat Okar, who serves as the Special Assistant to the President for Public Health and Disparities at the White House. Prior to serving in the Biden-Harris administration, Kat worked on the Biden-Harris transition team, where she oversaw the hiring of all presidential appointees for the U.S. Department of Health and Human Services. She's also served as a senior advisor at Waxman Strategies, consulting on public health, nutrition, and healthcare issues. And during the Obama-Biden administration, she served at the White House as the associate director of the Let's Move initiative in the First Lady's office and as a senior advisor in the Office of National AIDS Policy. So it is now my honor to welcome our first panelist for her presentation, Dr. Sarah Bleich from USDA. Sarah, let me turn it over to you and welcome.
Thank you so much, Dr. Gracia. Good afternoon, everyone. It's great to be a part of this very impressive panel. I'll kick things off with a brief overview of food and nutrition security and its intersections with childhood obesity, health equity, and structural racism. And I'll also highlight a few examples of how we are working to prioritize food nutrition security at USDA. And I'm happy to talk about other activities underway during the panel discussion. So let's start with food insecurity. So this past fall, the USDA Economic Research Service published our nation's annual food security report, which found that 33.8 million Americans lived in households that struggled against hunger in 2021. So a very sobering number. But the report also included some good news. So compared to last year's report, the number of Americans experiencing food insecurity decreased by 5 million. And food insecurity among households with children was at a 2-decade low. Now, the annual food security report suggests that one possible reason for this progress is how our federal nutrition assistance programs and the critical investments that we've been making during the COVID-19 pandemic helped to combat hunger. And these investments include USDA's historic reevaluation of what's called the Thrifty Food Plan, which serves as the basis for calculating benefits for the Supplemental Nutrition Assistance Program, which is known as SNAP. This action was important because it resulted in the first permanent increase to the purchasing power of SNAP benefits since the Thrifty Food Plan was introduced 45 years ago. And practically what it has meant is that there is an increase to monthly benefits by 21% or $36 per person per month. This change is a critical step for putting healthy food within reach. The report also highlighted that disparities exist. So for example, Black and Latinx households were disproportionately impacted by food insecurity in 2021, with rates that were triple that and double that of white households. So now let's switch gears to discuss our efforts to promote food and nutrition security. What COVID-19 did is it brought health disparities and the vital need for access to healthy food right up to the forefront. But disparities in diet-related diseases are a long-standing problem and associated with decades of structural limitations to retail food outlets that sell healthier foods. And these disparities often coexist with food insecurity and are also rooted in other long-standing historical inequities in education, employment, housing, and lots of other domains. We also know that health disparities start early. So for example, Black and Indigenous children are more likely to be overweight or obese. Now at USDA, we recognize that structural racism harms health in ways that can be described, measured, and dismantled. We also recognize that confronting structural racism not only requires changing individual attitudes, but also transforming policies. So we are looking carefully at our policies at USDA to identify ways to incorporate health equity. At the same time, USDA is calling attention to how poor nutrition spans all demographics. So what we know empirically is that poor nutrition is the leading cause of death in the United States and responsible for more than 600,000 deaths per year. And as detailed in the State of Childhood Obesity's latest annual report, poor nutrition and diet-related diseases have far-reaching impacts beyond health, including decreased academic achievement and increased financial stress. And these impacts translate to societal impacts as well. So reduced worker productivity, weakened military readiness, and skyrocketing healthcare costs. So let's switch gears now and talk about nutrition security. What is USDA doing to advance food nutrition security, and what is nutrition security? So since early 2021, USDA has taken a dynamic approach to tackling food and nutrition insecurity and prioritized building awareness about how and why the department is widening its aperture to also focus on nutrition security. So fundamentally, at USDA, we have come to define nutrition security to mean that all Americans have consistent and equitable access to healthy, safe, and affordable foods that are essential to optimal health and well-being. And there are two core motivations for this evolution. The first is the promotion of health equity, which means everyone has a fair and just opportunity to be as healthy as possible. And the second is that the recognition that structural inequities make it hard for many people to eat healthy and to be physically active. Now, one key message I want to leave all of you with is that USDA is not abandoning our decades-long focus on food insecurity. Instead, we are building on and complementing it with this additional focus on nutrition security. I really encourage you all to explore our report and web pages about our actions on food nutrition security. Briefly, what I can say is that the work at USDA on nutrition security is categorized under 4 pillars. So the first is providing meaningful nutrition support from pregnancy to birth and beyond. The second is connecting all Americans to healthy, safe, affordable food sources. The third is developing, translating, and enacting nutrition science through partnership. And the fourth is prioritizing equity every step of the way. All of this work at USDA is driven by research. It's grounded in science. It's woven into USDA policies. It informs each of the department's decisions. And most importantly, it impacts every life touched by the federal nutrition assistance programs and other key equities across our department. Now, besides the recent historic evaluation of the Thrifty Food Plan that I talked about earlier, I do also want to call attention to our proposed rule to update the food packages for the Special Supplemental Program for Women, Infants, and Children, which is known as WIC. And this was announced last week. So the proposed changes aim to align the foods provided to WIC participants with the latest nutrition science and have potential to support equitable access to nutritious foods during critical life stages. WIC serves more than 6 million women, infants, and children in an average year. But this, and just under half of all infants born in the United States are also served by WIC. But the challenge is that only about 1 in 2 who are eligible for WIC participate. So part of my effort to lead a whole of department approach to tackling food, nutrition, and security has been calling on all of you here today, among many others, to help us ensure that we reach millions more who are eligible for WIC. Without question, when we move the needle on increased participation and improved nutrition in WIC, we can expect to see meaningful impacts for millions of families. And collectively, the proposed WIC food package changes aim to reflect the latest nutrition science, but are also tailored to make the program more attractive to current and potential participants. And these changes aim to encourage more eligible women and young children to get connected to WIC and stay connected to these vital services. And I was very happy to hear Dr. Gracia say at the top that TIFA is supportive of this proposed rule and plans to submit a public comment. Now, you will hear more about the comprehensive actions laid out at the White House Conference on Hunger, Nutrition, and Health and in the National Strategy from Kat Okar from the White House Domestic Policy Council later on in this panel. This includes WIC, along with several other policy actions. Now, of the dozens of actions listed for USDA in the National Strategy, my message to all of you is that our top priority is a pathway for healthy school meals for all. This would essentially reorient the school meal programs from being an ancillary service to an integral component of the school day. So like books and desks and computers. So let me just wrap with a heartfelt thank you to all of you for all the work that it took to lead up to this moment and all that is to come. When I was a little girl, my family and I directly benefited from several of the nutrition assistance programs that we've been talking about. So I was a SNAP baby when it used to be called food stamps. I was a WIC baby and I was a school meal baby, along with my brother and my twin sister. And now I have the privilege of working with all of you and many others to make these programs even stronger through a unified approach. So look forward to hearing from the other panelists today and discussing with all of you how we can collaborate on ways to make sure that all children in this country thrive and achieve food and nutrition security. Thanks.
Thank you very much, Dr. Bleich. Such a terrific presentation. It's generated a lot of interesting questions from our audience. We're gonna, and please to our audience members, continue to submit your questions in the Q&A. We're gonna next hear from Cheryl Lee Sherry from the Minnesota Department of Health. Welcome, Cheryl Lee, I'll turn it over to you.
Thank you, Dr. Gracia, and greetings. Again, my name is Cheryl Lee Sherry, and I manage the Minnesota State Physical Activity and Nutrition Grant Program and work with a great team here at the Minnesota Department of Health. And I'm honored to be presenting about our SPAN activities for this important and timely webinar. And so I'm bringing it down to the state level and to the local level, my presentation. The State Physical Activity and Nutrition Program, or SPAN, is a multifaceted public health approach to addressing the increasing obesity rates and improving healthy nutrition access. The 4 components of this program include increasing breastfeeding, implementing healthy food and physical activity guidelines in early childhood care and education sites, updating and improving food service guidelines in public buildings and facilities, and increasing access to physical activity. In Minnesota, we also address health equity through community-driven pilot projects to allow for the community to decide which components they would like to focus on. Next slide. The SPAN program funding is important for Minnesota. If it wasn't for federal funding and state investments, our results would be much higher than the national average. Next slide. Our work, as well as our partners' work, is contributing to maintaining a relatively slow upward trend. This rate remains firmly below our neighboring 4 states who have been experiencing increases during this same time frame. Our work represents a long-term investment in obesity reduction, the fruits of which will take years to realize. Next slide. Through our SPAN funding, we address the entire life cycle of nutrition and physical activity for Minnesotans, with a particular focus on helping people build healthy habits from a young age. Our Office of Statewide Health Improvement Initiatives, or OSHI, brings assets to our SPAN grant. In particular, our State Health Improvement Partnership, or SHIP, which is a Minnesota state investment, allows our local public health agencies and tribal nations to partner with their communities in prioritizing and implementing evidence-based strategies that are designed to create healthier communities. Next slide. We have established strong relationships with state partners, such as the Departments of Agriculture, Education, Human Services, and Transportation, just to name a few. However, the complicated, comprehensive nature of this work requires strong relationships, partnerships, and expertise at the local levels. Through local public health leadership that our SHIP program is active in, this map shows the partner sites, collaborative partnerships, and engaged community leaders across Minnesota. We can't do this work alone. It is critical we establish strong and maintain strong partnerships. SHIP provides a valuable infrastructure in which we draw upon for our SPAN work. And next, I'm going to highlight our work in describing some of the SPAN components. We know the benefits of breastfeeding help make babies and birthing people healthier. Through SPAN, we support the implementation of evidence-based breastfeeding strategies that address infant feeding care practices in birthing facilities, improve continuity of care, and community support for breastfeeding and increasing workplace compliance with the federal and state lactation accommodation laws. Next slide. With an equity focus, we collaborate and support Indigenous lactation training courses and continuity of care. And one of our community projects created a lactation storybook for the African American community through an extensive community engagement process. Next slide. As a SPAN recipient, we've had the opportunity to apply for additional funds through TA and training providers, such as the Association for State Territorial Health Officials, or ASTO. We received funding to establish a system in providing pasteurized donor human milk to newborns as a temporary bridge for parents experiencing low milk supply and financial need. The food shelf at North Point, a federally qualified healthcare center, was one of our pilot projects. And when I say food shelf, we mean, in Minnesota at least, we mean food bank or food pantry. We strive to build on healthy habits by ensuring early childhood care and education sites are providing the healthiest food they can, and by implementing physical activity friendly guidelines. In addition to advocating for policies and system changes to incorporate healthy eating and physical activity education and training for our state quality rating and improvement system, or the QRS, we take the lessons learned from other grant funding and have incorporated into our SPAN work. Also, other ECA activities have included offering physical activity learning sessions, training on best practices for physical activity. Next slide, please. With over 40% of Minnesota children in the care of family, friends, and neighbors, new models of supporting these childcare providers must be supported and integrated into the formal childcare system of support and education. We created a toolkit in partnership with 2 successful, diverse, local family, friend, and neighbor networks for our local public health agencies and others. And this is an example of a community-based approach to address early childhood health and education inequities. Next slide. We want to make sure that when someone enters a public facility, a healthy food option is available to them. We work with state and local public health agencies to increase the number of public facilities and workplaces that adopt food service guidelines and ensure sustainability. We are developing best practice standards and an implementation toolkit for food and beverage guidelines in public places, and then we'll disseminate it throughout the state. In response to the increased need for emergency food services during the pandemic, we pivoted our SPAN activities to support the Safe Choice Project in partnership with the University of Minnesota Extension Super Shelf team and the Foundation for Essential Needs. With support from our project partners, food shelves were identified across the state to purchase materials and supplies needed to allow shoppers choice in the food that they received while maintaining COVID safety for both the staff and shoppers. Next slide, please. We also strive to increase opportunities to be physically active for people of all ages, improving safety and access for active transportation and mobility focuses on increasing routine physical activity through daily movement, such as walking, biking, and using transit for a portion or all trips to everyday destinations. Enhancing access to places for physical activity involves changes to the local environments, such as creating walking trails and providing access to existing nearby facilities and destinations, such as parks or grocery stores. Increased access is typically achieved in a particular community through a multi-component strategy that includes training or education for participants. Next slide. Through SPAN, we conduct walkable community workshops to guide communities through a coalition building process to develop and implement master plans and land use interventions that prioritize safer walking environments. Next slide. Next slide. Oh, no, we're good. Through SPAN, we also provide resources and training and TA to communities to capitalize on our experience of doing equity and health equity analysis. We wanted to identify and develop and implement new physical activity and nutrition strategies in addressing inequities for specific priority populations. Next slide. As one of only 16 states that currently receive SPAN funding, we are appreciative and supportive of the National Strategy on Hunger, Nutrition, and Health recommendation to expand SPAN to all 50 states and the territories. This would not only allow Minnesota to continue receiving funding for our critical work, but also allow other states and territories to build the same opportunities to be healthy. Thank you.
Thank you very much, Cheryl Lee. Wonderful to see what you are doing in communities across the state of Minnesota and how you're really embarking upon multi-sectoral partnerships to do this work in centering equity. We are going to now turn to our third panelist, Kat Okar from the Domestic Policy Council at the White House. After Kat's presentation, we'll then move into our Q&A, so please keep submitting your questions. I'll now turn it over to Kat. Welcome, Kat.
Thanks so much, Nadine, and thanks so much to TIFA and everyone for having me. TIFA has been such an incredible partner to us. As you may know, we cited the latest State of Obesity report in the White House strategy on hunger, nutrition, and health, and TIFA is just a tremendous partner overall. So again, thank you so much for having me here. It is such a privilege to be with you all today, to learn from you, and to talk a little bit about the White House conference and the strategy, and frankly, where we go from here. I was privileged to be one of the co-leads on the recent White House conference, and there has never been a more important time to discuss hunger and nutrition and health in this country. What I found most startling about TIFA's report is that not only do 19 states have obesity rates over 35%, including my home state of Ohio, but a decade ago, no state had an adult obesity rate at or above 35%. No state. That was just 10 years ago. This seems like lightning fast increase in obesity rates. And we know rates of obesity reflect disparities in communities of color and rural communities that continue to persist year after year, not just in obesity, but other diet-related diseases as well. And I know I'm preaching to the choir here, but we need to take action, and we need to take bold action. So go to the next slide, please. And next slide again. Perfect, thank you. So this is really why in September, the president hosted the first White House conference on hunger, nutrition, and health in over 50 years and released a national strategy focused on one ambitious goal: ending hunger and reducing diet-related disease by increasing healthy eating and physical activity, underpinned by reducing disparities. And the reducing disparities piece is critical. We don't want to continue to perpetuate inequities that persist year after year. And that really means making a concerted effort to think about the communities that are historically left behind. Next slide. So the national strategy is really anchored on 5 pillars, which I'll talk a little bit more about, but it provides a roadmap for actions that we, the federal government, will take administratively, but it also includes a number of proposals that we are pushing for and encourage congressional action. And lastly, it includes a call to action for how entities across all sectors, including you, whether you're in state government, local government, as a CBO, private sector, et cetera, how you all can bring about the changes necessary to meet these goals as well. The strategy was really informed by the input of, you can go back a slide. The strategy was really informed by the input of countless Americans. We tried to hear from as many of you as possible. So from public health experts to advocacy organizations, school districts, faith groups, people with lived experience of hunger and chronic disease, among many other communities via several listening sessions and by collecting online submissions and stories. And hopefully many of you participated in some of those. And so at the end of the process, we identified 5 pillars or priorities, frankly, for action to frame the strategy. And as I'll note today, and as Nadine pointed out, there are a ton of synergies with the recommendations that TIFA has made in their State of Obesity report and the strategy. And hopefully you'll see public health importance in all of these efforts and really see this as a full spectrum effort instead of just nutrition or just physical activity, but really this is a structural and systemic issue that is a huge piece of the puzzle here. So on the next slide, you'll see that our pillar 1 really focuses on improving food access and affordability. And in order to do that, we know that we have to address the root causes of hunger. And so that's why in the strategy, we highlight that the administration is really pushing for Congress to put more money in the pockets of American families through things like the child tax credit, through raising the minimum wage, investing in childcare, expanding Medicaid coverage and closing the Medicaid coverage gap. But we also know that nearly 40 million Americans live in areas where grocery stores aren't even close by. And so that's why when we talk about investing in community and economic development, we're thinking about ways and trying to help entities use federal funds to, for example, convert a space into a corner market store or develop a grocery store in an area with limited access to affordable and nutritious foods. But it also means we're working to strengthen and improve access to federal assistance programs like Sarah mentioned, school meal programs, SNAP and WIC. And that of course includes advancing a pathway to healthy free school meals for all. It means making it easier for individuals that qualify for things like SNAP to also access things like Medicaid and childcare subsidies. But we're not just focused on food access and affordability. We're working to better integrate nutrition into the healthcare system. And so on the next slide, you'll see what we're doing in this space. Our work in this area really means expanding access to what we are calling and what have been deemed food as medicine interventions. And it's really a pretty straightforward concept. This could look like increasing insurance coverage for, say, when a doctor who normally prescribes medications prescribes an individual fruits and vegetables to increase healthy eating. This also means screening for food insecurity. How many of you have gone into a doctor's office lately and they ask you questions like, are you worried about where your next meal will come from? Increasing food insecurity screening helps providers know when a patient is food insecure and connect that person with services like a food bank or with SNAP. And we want to enable providers to offer that counseling on nutrition, on food insecurity, on obesity. And so that means not only ensuring physicians and nurses get the training on nutrition basics, but that also means we will invest in training more nutrition professionals. So that's what we mean by bolstering the healthcare workforce. Next slide. When we talk about Pillar 3, we're really focused on empowering Americans to have and make access, have and make healthy choices, making the healthier choice the easier choice. And so this is just a smattering of the pieces of the puzzle of the strategy that we're doing. But one of the pieces that I think is most exciting is working to develop a front of package labeling system. So other countries have done this. So maybe you see a certain number of stars or a stop sign or a red, yellow, green light on the front of a package. And that helps you identify which foods are healthier and which are a little bit less healthy. So that's something that we're working towards. We're also striving to make it easier. So when you are grocery shopping online, you can see the nutrition information. We're also trying to reduce the sodium content in food and make it, and also, as well as added sugars. I think we all can attest to the fact that there's too much sodium, too much added sugars in our country's food supply. And so we're really trying to take steps to lower that. And then certainly we're striving to create a healthier food environment by incentivizing the purchase of fruits and vegetables with SNAP dollars. So we're working with Congress to expand those initiatives. But we're not just focused on food. On the next slide, you'll see that we're also thinking about physical activity as well. And so that means we're really trying to build environments that promote physical activity. So of course, we are hugely supportive of expanding the SPAN program, as Cheryl Lee pointed out, the tremendous work that they're doing in Minnesota. And we want to see that work in all 50 states. We're also really trying to connect more people to parks, particularly in nature-deprived communities. Less than half of people in this country live within a half a mile of a park. But we also know we need to invest in what guidelines people are using for physical activity. So we're pushing to fund things like physical activity guidelines for Americans. So those continue to be updated. And of course, we're trying to support physical activity in school districts and in federal facilities. So whether that's trying to practice what we preach by making it easier to be physically active in federal buildings, or encouraging state and local school districts to bolster their physical activity time requirements. And last but not least, on the next slide, we're of course thinking about research. We want to ensure we are basing our nutrition policies on a sound body of evidence. And we know the nutrition science is constantly changing. If you think about 20 years ago, how different the guidance was to now. And so we are really focused on bolstering that funding for nutrition science and working with Congress to make that happen. As with the other pillars, equity is, of course, the cornerstone of this goal. And so we really want to ensure that marginalized communities benefit equitably from the research that we are hoping to fund more and more of. So for example, for the dietary guidelines for Americans, HHS will select a diverse group with different points of view, different experience, different educations to really ensure that the diversity of the US is reflected in the dietary guidelines and that they reflect and resonate with the diversity of this country. So that's what we've committed to doing. On the next slide, you'll see, but if we want to end hunger, it will take all of us. And so we worked with, on the next slide, you'll see the CDC Foundation to cultivate commitments from non-federal entities, from philanthropy, from the private sector, from state and local governments. And we're able to garner $8 billion worth of commitments. Washington State has a tremendous example of doing an online pilot for WIC and other activities. Chobani is also doing, really trying to cultivate businesses to adopt a school and practice what they preach by paying their employees at least $15 an hour. But this is just the first tranche. And so as we're thinking about, and I think most people ask me, the number one question is, so what's next? What can I do? On the next and last slide, as the president said, this is just the beginning. We are, of course, focused on strategy implementation. We are, so that we are doing what we say we're going to do in the strategy, but we're also hopeful that additional companies, additional state and local governments and other entities will step up and join us to make commitments. That's where you all come in. We are continuing to work with the CDC Foundation on the next tranche of commitments. So I encourage you to reach out to them, or certainly can reach out to me and I can put you in touch with them. And we are working hard to keep our ear to the ground too. We don't want to just go into our offices and implement. We want to make sure that we're doing it in a way that resonates and is impactful. And so we want to continue to hear from you. So I'm hopeful you'll join our stakeholder calls, not today because it is happening as we speak, but my TIFA colleagues can share that information in terms of how to sign up. And we want your candid feedback. Tell us what you need from us to help implement the strategy in your own communities. As the president said, it's going to take all of us, and I look forward to engaging with all of you in the work ahead. Thanks so much, and back to you, Nadine.
Fantastic. Thank you so much, Kat, to hear the level of commitment from the White House with regards to addressing hunger and nutrition and diet-related diseases with the historic conference, with a national strategy, really is so compelling. And you're hearing, hopefully, in our audience, the level of synergy as well. And it's across sectors about some of the key areas that need to be addressed. So that concludes our panel presentations. We're now going to open up for our Q&A, and we've been seeing some robust questions coming in from our audience. Please continue to submit your questions, and we will get to as many questions as possible in our time remaining. I'm also happy to be joined now by my colleague, Madison West, who is Associate Government Relations Manager at TIFA, who's going to help us to moderate the Q&A. Madison, let me know if you are ready or if you'd like me to toss in the first question.
You could kick us off with the first question. That would be great.
Great. Well, let me go to Sarah, actually. And Sarah, you touched on so many critical and important things, and it's wonderful to see, in particular, your real expertise in bringing that public health lens into this work for USDA. And one of the things that you said was a top priority and something to leave the audience with was getting to a pathway, for example, to healthy school meals for all. And I would love for you to expand a little more on that and also talk about the public health tools that you see USDA has at its disposal to really be able to advance these issues around food and nutrition security.
Just taking myself off mute. Yes, so great question. So in terms of advancing healthy school meals for all, this is something that sits within Congress. They would have to make the decision to do it. We at USDA are very supportive of it because we do see it as one of our top priorities at USDA. And just to take a step back and talk about why it's so important, every day, 30 million school children receive free reduced price meals. And these meals have been shown to have all sorts of positive benefits. So they've been shown to improve diet quality. They've been even shown to reduce obesity. They've also been shown to have other impacts beyond nutrition and health, such as improved academic achievement. So there are a lot of public health reasons why it would make sense for all children, not just children who are currently eligible, to have access to healthy school meals in all schools. So that's something that we will be pushing very hard for in the weeks and months ahead. I would say, to echo what Kat was saying around this is a whole of country approach, there's a lot that states can do in this space. So for example, there already are some states like California, like Massachusetts, that have made the decision to go ahead and provide meals to all school children. And these are really important steps that are going to get us as a country to where we are trying to go at the federal level. The second part of your question, Dr. Gracia, is sort of what are the tools that we bring to bear? Well, we certainly, we have the existing National School Lunch Program. We have the existing National School Breakfast Program, which are the programs that we are looking to expand to all children. Wrapping around those are a lot of education programs like Team Nutrition. We also provide technical assistance. So there are some schools that need equipment to actually do cooking from scratch. And so we provide equipment grants, we provide technical assistance to help school food operators identify how they can provide healthy food to children. So it's not enough to just make the food available. There's a lot of wraparound things that have to happen, including leveraging local and regional food systems, training up school food service providers, helping do more around nutrition education in schools. These are all areas that we work in, but there are also areas that we can do more. And so we are going to be moving full throttle ahead, but are really looking to partners around the country to help push forward with this effort because it matters to young children. It will make a difference in their trajectory. We know that many young children are predicted to have obesity when they get older. And so if we can hedge against some of that by using policies to get children in the healthiest position possible, it is going to benefit the country. So just appreciate any efforts that are being done by those who are listening to lean in on this really important policy area.
Thank you so much, Dr. Bleich, and in particular, how you also articulated the importance of focusing on this with our children and really trying to ensure we have healthy children who become healthy adults and have opportunity, that prevention and public health focus. And again, hearing that in particular from the USDA that has these important tools that it can use to really help advance this. We did get a message in the chat. I want to shout this out as well, that we have someone from Maine stating that Maine also supports healthy school meals for all. So again, that kind of momentum is really important in what we can see in states across the country. Madison, shall I turn to you, or I can continue with questions?
Yes, this next question is for Cheryl Lee. So there's quite a few questions in the chat regarding the importance of nutrition education, particularly for children and families. And we would really appreciate hearing more about your experience of nutrition education and supporting the communities that you work with.
So for nutrition education, we collaborate with our University of Minnesota Extension. So through their SNAP Ed funding that they have, we work along with them. I saw another question in regards to about how do you not duplicate some of the services. So we really we collaborate and we really figure out what each other's doing and how can we align the work so that there's not duplication. I would also, just in regards to thinking about the life skills and just, nutrition education and all of those kinds of things, there are national health education standards for schools. And this was developed through a coalition of health education organizations. And I would encourage people, as we're talking about kind of on the national and state levels, really supporting comprehensive health education standards using the national standards. It talks about health literacy, because a lot of the things that we talk about is health literacy, and bringing it in, and everything's age appropriate in that, and then it's up to the schools to figure out how they're going to go about doing that as well. But just in essence, it's like collaborate, know what other folks are doing, and then find, it's like working with your communities to figure out, well, how could you develop something that's sustainable so that there is cooking classes and food available for people. So.
Excellent, thank you. This next question is for Catherine. A question in the chat talked about community factors such as housing, transportation, and community safety. And we know that those conditions can be referred to as the social determinants of health. And so this person was wondering what the federal government and across agencies and across departments is doing to think about the social determinants of health as it's continuing to implement the national strategy.
Sure. Thanks, Madison, and thanks to the person who asked the question. I think there's a lot, as we all know, social needs and social determinants of health are expansive. And so a few of the things I mentioned earlier on in terms of putting more money in people's pockets, when the president talked at the conference about permanently extending the child tax credit, about closing the Medicaid coverage gap, about thinking about and subsidizing childcare. And so these are some of the pieces of the puzzle, and apologies if there's background noise on my end, but these are some of the pieces that we're thinking about in terms of just broadly social needs beyond quote unquote the doctor's office. But we also recognize that needs to come into the doctor's office as well. And so that's one of the reasons why you see in the strategy a huge focus on ensuring for Medicaid beneficiaries and Medicare beneficiaries, as well as veterans and military families and our military members, making sure that the healthcare system is screening for things like food insecurity, but not just food insecurity, but housing and employment and other social needs that we know and are inextricably linked with health. And so I think there's a lot there that we're trying to do and are pushing Congress to do as well. And we're not planning to let up anytime soon, but that's one of the reasons why, we really try to lean as much as we can in on the strategy, and we'll continue to do so.
Excellent. Thank you so much. This next question is for Dr. Bleich. One of the people who is attending this webinar noted that although some people may have access to food, those foods may not be nutritionally healthy for them, or they might have an overrepresentation of nutrients like fat. And so could you discuss how this understanding is implemented in the nutrition security framework and what work USDA is doing to address this issue?
Yeah, great question. So first off, I would say that the person who asked this question is spot on. Just because you have access to food doesn't mean that you have access to healthy food and or that you're making choices that reflect a healthy diet. So in terms of things that we're doing, there's a whole lot that's happening in the space of trying to help consumers make healthy choices. And also I'll make sure that our programs are supporting that as much as possible. When I say programs, I'm referring to the suite of 15 federal nutrition assistance programs. So one key thing that I mentioned, but I do think it's worth repeating, is what has happened with the SNAP program. That's formerly food stamps, the Supplemental Nutrition Assistance Program. So when in October of 2021, there was a reevaluation that happened. It was not cost neutral, which meant that the overall size of the SNAP allotment increased on average by 21% or $36 per person per month. This is a game changer for putting healthy food within reach. Another important thing that happened this October 2022 is that SNAP is designed to adjust for inflation. And so this year, the average size of the SNAP benefit increased by 12.5%, which is one of the largest inflationary increases in the history of the program. So that means if someone was going to the market and they wanted to purchase something that might be unaffordable for someone who's not on the program because of how prices have gone up, that item should still be in reach. So that's one important thing that's happening with SNAP. Another important thing is that update to the WIC food packages that I mentioned. WIC is one of the strongest public health programs that we have. And this update is aligning WIC with the latest nutrition science. This is going to make the positive outcomes that we've seen for this program even stronger. And a third to mention is school meals. So we are going to be having a proposed rule on school meal standards, which will strengthen the standards of what kids eat in school. There's a lot of evidence that we know from the Healthy Hunger Free Kids Act, which looks at some of the questions that were raised in the chat, like, well, if the foods are healthier, does that increase wastage in school? The answer from the evidence, from a robust evidence, is that that's not the case. Does it lead to more kids not taking the meals? No, in fact, there's a lot of curiosity from the kids in taking the meals. Does it increase diet quality? Yes. Does it reduce obesity? Yes. And so there's a lot of evidence about the programs that we run that is driving toward healthy choices. And then there are other things that have happened that are just going to make it easier. So a game changer, another one that happened during the pandemic, is that now 49 states and the District of Columbia allow individuals who participate in SNAP, which is about 41 million Americans each month, allow them to use their benefits online. Prior to the pandemic, this was only 5 states. What this means practically is about 97% of participants can go online and make purchases. That's significant if you have physical access problems in the places that you live, because now you can go online and get those foods delivered to you. So none of this is perfect. We have so much more work that we can be doing. But I guess the message that I would want to leave with the person who asked the question and those of you who are listening is we take the importance of nutrition security for all Americans extremely seriously. And we are looking across all of our programs to ask the question, what more can we do to make sure that all Americans have consistent and equitable access to healthy, safe, and affordable food? And this directly complements the goals of the White House Conference, which are to end hunger and reduce diet-related diseases and disparities by 2030. So we're very much in lockstep and looking to use all of our equities to drive toward meaningful solutions.
Fantastic. Thank you so much. We are coming right up on our time here, so I'm going to turn it back to Dr. Gracia to provide us with closing remarks. And thank you everyone for submitting your questions.
Thank you, Madison, and thank you again to all of our panelists. As you can see, it's not only a wealth of information, you can see the depth and level of commitment from all of our panelists with regards to these critical issues as it relates to addressing obesity, to reducing hunger, and reducing diet-related diseases and advancing healthy nutrition. We want to thank all of you for tuning in. We've been putting information into the chat as well, and we're going to have follow-on information after today's webinar that you can have to use in the work that you do each and every day. Let me thank as well our staff at Trust for America's Health who have been behind the scenes helping to ensure the logistics of this webinar has moved through smoothly. Clearly, this is an issue that we are going to continue to work on. It's an issue that we must all work on together, this whole of country, whole of society approach to really addressing these issues, social determinants of obesity, to advancing equity and ending disparities. So to leave you, we are going to have a recording of this webinar along with the slides from all of the presentations and additional resources that will be available on our website at Trust for America's Health at TIFA.org in the coming days. So do stay tuned for that. And we thank you again for joining us. Take care, everyone, and thank you. We look forward to continuing this movement together.